The Orange County Healthcare Agency operates hundreds of behavioral health programs available to the community. One of these is the Behavioral Health Services Outreach and Engagement Program. Outreach is the process of reaching out to unserved individuals needing connection to support services. Engagement is the trusting relationship developed between the worker and the participant to reduce or eliminate barriers to services or housing.
Our job is to link the homeless and at risk of homeless individuals to needed services, such as mental health services, substance use services, or other supports like housing.
The program is staffed by licensed and pre-licensed clinicians, nurses, and mental health and substance use staff with lived behavioral health experience. Services are provided in English, Spanish, Vietnamese, Farsi, Korean, Thai, and Cambodian.
I absolutely love my job and the ability to be able to go out in the public and help those people who are in need of receiving help and are not able to get it for themselves.
One of the best parts of the day is when staff comes in and is really excited to share how they either help someone move into their new apartment or we're able to take them to the doctor for the first time.
The best thing is when you hand them the key and they open up the door and they just stand there and you get to see the joy and the tears come down their face, and more than often the tears are coming down my face as well.
I got my place. This is my bed. This is the kitchen. I can cook in there. Can you believe it? That was my dream. Now I have my dream. That's real. That is rewarding when I feel that I'm a part of that journey.
There are 3 types of outreach activities the program uses to serve our target population. The first is street outreach. Teams go to known gathering places for the homeless like parks, bridges, shopping centers, and work with an individual at their own pace. Since the participant knows that our Blue Shirt staff will be back every week at that location, they can build a trusting relationship with staff and continue to check back in until they are ready for the next step or services. The second is fixed site outreach. Staff regularly visit homeless at locations around the county where people are known to congregate. Places like the Civic Center, the Courtyard, the flood control channels, armories, libraries, places like that throughout the community. The third type is field contacts. Outreach and Engagement provides a toll-free triage line where anyone from the community can call and staff will respond to any location within Orange County to provide support and services.
Behavioral Health Outreach and Engagement's job is to connect vulnerable participants to mental health and substance use services, medical evaluation and treatment, and housing.
There's a lot of work in what we do in trying to connect clients to, connect our clients to resources and programs and services to help them get back on their feet again. But I would say one of my top favorite things to do is just talking with clients.
And really bridging that gap between the individual who continues to have frequent law enforcement interactions and really trying to get them to understand each other, where they're coming from, and how they can work towards the same goals, whether it be getting linked into behavioral health services, substance use services, or even housing.
Outreach partners with cities, shelters, and law enforcement to support the linkage of homeless participants to behavioral health services. We work directly with parents, families, and loved ones when they aren't sure who can help them.
Thank you for taking the time today to learn about our services. If you know someone who could benefit from outreach, please contact us online or through the number on your screen.